My name is Dr. James Donovan, and in this video, my colleague Ella Boys, a qualified physiotherapist, is going to guide you through 10 exercises designed to support recovery from an LCL sprain. The LCL, or Lateral Collateral Ligament, sits on the outside of the knee, as you can see here, and it helps to keep the knee joint stable. Injuries to this ligament can cause pain, instability, as well as reduced movement, especially during side-to-side motion. These exercises will focus on regaining range of motion, strengthening key muscle groups, as well as restoring knee stability. You don't need any specialist equipment to get started, just a towel, a pillow, a step, and an optional exercise ball. And as always, please check with your healthcare provider before beginning these exercises to make sure that they are suitable for you. Exercise 1 is a heel slide with your ankles crossed. Start by lying on your back with both knees bent. Next, bend your affected knee, sliding your heel slowly backward. If you wish, you could hook your opposite foot around the ankle of your affected leg to help gently pull it further, which Ella is demonstrating here. You can hold it for 3 to 6 seconds, then return to the start and repeat it 8 to 12 times. This is great for improving knee flexion, but stop if you feel any sharp pain. Exercise 2 is a heel slide on a wall. Begin by lying on the floor with your hips close to a wall, both feet resting on it. Next, let your affected foot slide slowly down the wall until you feel a stretch in your knee. Hold that position for 15 to 30 seconds, then slide the foot back up before repeating this 2 to 4 times per side. Keep your hips relaxed and flat on the floor for a smooth motion. Exercise 3 is a quad set. Start by sitting or lying on a firm surface with your affected leg straight and a small towel rolled under the knee. Next, press the back of your knee down into the towel to tighten the thigh muscles. Hold this for around 6 seconds and then relax. You can complete 8 to 12 repetitions. Now, this simple move helps to reactivate the quadriceps, which are key for knee stability. Exercise 4 are short arc quads. For this, lie on your back with your knees resting over a foam or rolled towel. Next, straighten your lower leg by lifting your heel, keeping the back of your knee in contact with the roll. Hold it for 6 seconds and then lower slowly before performing 8 to 12 repetitions. This exercise isolates your quads and helps rebuild strength safely. Exercise 5 is hip flexion with a straight leg raise. Start by lying on your back with your affected leg straight. Next, press the back of your knee gently into the floor to activate your thigh. Then, slowly raise your leg about 12 inches off the floor, hold for 6 seconds, and then lower. You can repeat this 8 to 12 times. For this exercise, it's important to keep your core engaged to avoid straining your back. Exercise 6 is a seated hamstring set. Begin by sitting upright with your affected leg bent, foot on the floor. Then press your heel into the floor to tighten the hamstring. Hold for 6 seconds and then relax. You can repeat this 8 to 12 times. Exercise 7 is hip abduction, also known as a seated pillow or towel squeeze. For this, sit on the floor with your knees bent and a pillow or folded towel between them. You can also place your hands slightly behind you for support. Next, squeeze the pillow or the folded towel using your inner thigh muscles, hold it for 6 seconds and then relax. You can repeat this movement 8 to 12 times. Now, controlled movement here builds strength in the adductors, supporting lateral knee stability. Exercise 8 is a resisted hip abduction. You can place a resistance band above the knees. With your knees bent at a 45-degree angle, as you can see here, open up the knees, separating them. Hold it and then go back to the starting position. Do 8 to 12 reps. Now, strengthening your outer hip muscles will improve alignment and help reduce stress on the ligament. Exercise 9 is a lateral step up. Stand sideways at the bottom step with your affected leg on the step and the other on the floor. Lean slightly forward and use your top leg to step up, bringing the other foot up to meet it. Then slowly lower yourself back down. You can repeat this 8 to 12 times per leg. Now, for good form on this movement, keep your hips level. Your knee should track over the middle toe and try avoid letting the knee go past your toes. Also try to keep your heel flat. Now, this is a great functional exercise and you can hold a railing, table or a chair if you need extra balance. Exercise 10 is a wall squat with ball. For this, stand with your back against a wall and place an exercise ball between your back and the wall. Next, step your feet forward so that they are shoulder width apart and about a foot away from the wall. Then tighten your core and slowly lower into a squat, letting the ball roll behind you. Hold it for 6 seconds and then rise slowly. You can repeat this 8 to 12 times. Now, wall squats safely activate the quads and the glutes whilst keeping pressure off the knee. Thanks for watching, and remember that recovery from an LCL injury takes time and consistency. Stick to gentle, controlled movements and focus on building strength gradually. And if this video helped you, be sure to like, subscribe and check out other rehab routines with Ella and I on this channel.